Hi, everyone. For those of you who don't know me, I'm Melissa Wessner. I'm the owner of LifeSpring Counseling Services in Towson, Maryland, and I'm a licensed clinical professional counselor and a certified brain spotter. And today
I'm Madison Hager, and I'm LifeSpring's virtual assistant. So I assist with scheduling appointments, taking calls and emails, and a lot of other behind the scenes stuff. So
one of the services that we offer at LifeSpring is Brainspotting. We get a lot of calls about this. And even though we try to offer a lot of information about Brainspotting on our website, and when we're meeting with people individually, we try to make sure that we're giving information to help people understand the process. Brainspotting is really different than every other form of therapy that you may have tried before. And so even though we're giving information and we're talking about what to expect, a lot of times it can still be really confusing. And I find that after people have their first Brainspotting session, then they're like, oh yeah, I get it now. And we don't usually have the opportunity to show you what a Brainspotting session looks like, but I think that it can be helpful for you to see what a Brainspotting session would look like so you know what to expect. So Madison's here with me today. Madison has never been in on a Brainspotting session, but we're going to role play today to show you what a Brainspotting session would look like. So hang in there with us so you can get an idea of what to expect. So Madison, have you decided what you want to be working on today?
Sure. So recently I've been having some issues with one of my friends. We've been very distant, and I just feel like I'm missing out a lot on their life. I don't really know where I am in terms of our relationship anymore. And, I'm just I've been going through the motions, kind of been upset, kind of been bothered. So I don't really know how to address that.
Yeah, and I know that this has been going on a while with this particular friend that you've been mentioning.
Mm-hmm.
When you're talking about that right now, what are you noticing?
I do notice that, I kind of get a bit shaky. My stomach starts to hurt. A lot of internalized feelings that I have that kind of come out physically. So,
Okay, and on that 1 to 10 scale, how strongly do you feel that?
right now, maybe about a 7.
Okay, and right now, where are you feeling that in your body?
Mostly in my stomach, kind of up in my chest a little bit, but more down.
All right, so I'm going to help you find the brain spot. So your only job right now, Madison, is just to make sure that you're noticing what you feel in your body, okay?
Okay.
So I'm going to have you think about that situation and just kind of notice how it feels over here. And over here. And over here. Where did you feel that sensation the most?
On the right side.
Over here?
My right. So yeah, the other side.
All right. So what I'm going to do is I'm going to move the pointer from the center over to the right. And as you're pulling that situation up, I just want you to notice where you feel that the strongest, okay?
Okay. Probably right around that area that you were just in.
Right here or back a little bit?
Probably around there.
All right. So what we're going to do is I'm going to go up from this spot and just let me know if it feels stronger when we go up from this spot or when we're back in the middle, okay?
Probably a bit stronger.
A bit stronger. Okay, so let me just keep going up a little bit and let me know if it's stronger when we go up or if I need to come down a little bit.
Probably back down to where you were before.
Okay. Just let me know when you need me to stop.
Probably around there.
Right here. All right, Madison. So we're going to get started. So what I want you to do is just going to pull up that situation that you were telling me about. And your only job right now is just to notice what thoughts, feelings, and physical sensations naturally arise With Brainspotting, we don't need to do a lot of talking, but if there's something that comes up that you want to let me know about, just let me know while staying on that spot. And if it's been a while since I've heard from you, I'll check in, okay?
Okay.
Now with Brainspotting, we are quiet for a really long period of time. Since I'm sure you don't want to watch Madison stare at my pointer for an extended period of time, we're just going to give you a sense of what would happen if it's been a while since Madison has been on this pointer. So Madison, while staying on that pointer, what are you noticing?
I'm noticing that a lot of these feelings and thoughts have been reoccurring. This has been an issue that's kind of been going on for a while. I guess at this point, this has happened a couple of times with this particular friend. So, nothing new, but it still does bother me after all this time. So,
yeah, so just notice what you're seeing show up. And Madison and I are going to continue to do this for up to a full session. So I'm going to take this down, Madison, if that's okay.
Okay.
So Madison and I would do this. If we're doing a typical Brainspotting session, we might be doing this for a whole session, maybe up to 50 minutes or so. Some people like to Brainspot for the whole session. Sometimes people only want to do 20 or 30 minutes of Brainspotting. But generally, that's what you can expect from a Brainspotting session. You're going to meet with your provider. You're going to pick your topic. We're going to see what shows up in that moment, any emotion showing up, where you feel it in your body. And then we're going to help you find that brain spot. And then you're going to stay there for quite a while. And as you saw with Madison, things will naturally show up, thoughts, feelings, physical sensations, and you don't have to try to make anything happen. Things will just naturally come up on their own. Sometimes people feel like they have to make something happen, or people get nervous about, am I doing it right? You're going to do it right. As I let people know, your body knows exactly what it needs to do to heal. So we're just going to trust the process and let whatever needs to come up, come up. So if you've been curious about Brainspotting and you've read the information, but you still didn't get it, just know that you're not alone in that. So we wanted to put together this video to give you a little bit of an idea of what you can expect and what a Brainspotting session would actually look like. So of course, I want to thank Madison for working with us for our little role play today. If you have any questions about Brainspotting, feel free to give our office a call. This is Madison. This is who you're going to be talking with. Otherwise, you can check out our website, lifespringcounseling.net, where you can find more information. Take care.